And I'm delighted to be here with Regina Holliday. That's at Regina Holliday with 2 L's. I'm at Dr. Nick #1. Regina is here at the HEMA conference, and you presented. I was fortunate enough to attend that presentation. As I said to you afterwards, I think that should be a keynote at HIMSS. Please, if you could, tell us why you're here, what it is that you're trying to achieve with your paintings and the patient engagement.
Wow, that's a great question. So I focus on patient engagement and how do we get the patient front and center in the medical conference, therefore become front and center in health policy and front and center in the clinical care environment. And I thought, how can we do this? Well, one way to do this is through paint. So I paint about patients in medical settings. I try to make people remember, at the base of all of this and why we're here, it is the patient.
Right.
And also to remind people that when you invite patients to the table to participate in these conversations, you're inviting them with their skill set. And their skill set may be very different than yours. So I may be an artist and I would like to bring painting into medicine and great images. And there may be a photographer who's going to post stuff on Flickr on a Creative Commons and they're going to give us realistic photography. Or maybe somebody works at Lowe's or Home Depot and they can tell you how you could have the right sink kit to not have so many infections. So let us be part of this from where we come from.
So as a clinician, that's foundational to me. As I was telling you earlier, I've had the privilege being a clinician, being involved in family care, and I get engaged, I insist on it. And I know that was the story that you described. I think it's a key requirement. And the most important thing for me is in that room with the patient, the next person that has the biggest vested interest is you. And clinicians and the healthcare community need to understand that. And I think you've articulated that really well by sharing what is a very personal story with your husband.
Yes. Well, him having cancer is what got me into this work.
Right.
He was treated at 5 facilities in 11 weeks, and we saw so many problems with the medical system that I thought I needed to leave my old life of working at a toy store and painting murals, like public murals, that were about children. Instead, begin to paint about medicine, and instead begin to speak about medicine and do everything I could to research what was going on within high-tech, meaningful use, blue button, infection protocol, so I could present it in such a way that people could understand it.
And that's part of the engagement. If you would do me one other thing and turn around,
sure,
back to the camera and show everybody the walking gallery. So this is the walking gallery. Would you tell us just a little bit about that?
Sure. This painting is
turn back as well,
my son's jacket. I wore it to this conference because I'm going to so many conferences in a row, I need multiple jackets. But his idea was he'd watched this Japanese anime show called Death Note. And he was 13 and he just really liked it. And then he heard me talking about the IOM report to err as human that came out in 1998.
Right.
And so he's like, Mommy, what I want you to do is I want you to get characters from Death Note, but I want the Death Note to be the IOM report because those people are dying every day and they're in that book. And I said, yes, that's a brilliant story. So he got to wear this at the walking gallery when we gathered, and he went explaining to doctors and technicians and nurses and just folks what it meant to him. And it was just beautiful watching him tie pop culture into what's going on within the world of medicine.
And one of the things about the walking gallery is it's precisely that. It's a walking gallery. We see them all the time now, really being very successful. You paint these and put them on jackets. And the other thing I would say is that it's always the children that teaches the most important lessons, and your son has done that. My daughter did that for me when we talked about the health record and focusing on the patient, not on the technology.
Well, and surprisingly, a lot of our artists that are part of the walking gallery, because I'm not the only artist, a lot of them are children. So they've joined the gallery, painted their own jacket, told their own story, and that's what we need to have. The young need to realize that they're in charge of their health,
Absolutely.
and they can fix the future.
All right, so thank you very much. Regina, thank you for joining me. Wish you good luck with the rest of the gallery and the rest of the conference.
Thank you so much.
Thanks.